might go a little slower first. It's up to you. If you're going to honk down the road, expect anything, and you'll be okay though. Just realize it's a body cleaning itself, a very essential issue for you. And this other person, who is this asking me about this? This is Harlem, about the appendix too. Same thing. You can use any type of oil, castor oil preferably, and put some castor oil packs on here and see if, even though heat isn't advisable in inflammation, because heat with heat, but still, if you put heat down that area, you could put some ice packs over that area, but I would also drive some castor oil in that area, very soothing, anti-inflammatory. You could take some anti-inflammatory like inflammation joints to help in that way, but it's still about a stagnant lymph system, and that means stagnant acidosis, and that could mean a lot of pain and breakdown of tissue. Be smart though, because if the appendix pops, you want to get yourself right along to the ER and have them do their thing. Oh, you like my Senator Andre? Yeah, that thing was heavy, but boy, it was cold that morning. It was no. When it's 70 here, it's cold. No, it was like in the low 60s. For some of you, that's probably pretty warm. I know. I never did like cold. Even growing up, I hated that. Indiana cold weather. Actually, what I hated most, probably, if I could use that word, is the gray skies, you know. It's so depressing. It's just like living in a prison, you know. This is 1122. Gretchen, infinite love to you. Same, my dear. Resubmission video 68. I was diagnosed in 07 with type 1 diabetes. Before that, I had gestational. That with third pregnancy, A1C norm year later, but then 6 months later up to 8.3. I have come to see this as a needed blessing. Good deal. I love fruit. I do. Do I cut back on the insulin? Does my body get used to the insulin injections? I tell you this, use the pancreatic formula. I put herbs in the pancreatic formula that control blood sugar, both low and high. However, type 1 is a pancreatic issue. Now, a beta cell issue. Now, here's the thing, and I've talked about this before. This could be a neurological type 1. That would take it back to the adrenals. You're always going to work on the adrenals irregardless. Those glands are essential to work on. I could probably be pretty close to accurate if I said 99.999% of all Homo sapiens have some degree of adrenal weakness. I'd probably be real accurate, and I could probably say probably 50% of humans or more have chronic adrenal problems, and that's serious in so many ways. Neurotransmitters, steroids. These neurotransmitters are for your autonomic nervous system. That controls beta cell production of insulin, breathing, heart rhythms. You know, this is everything. This is the stomach and solar plexus. And I talked about this yesterday. When you have stomach problems, you can have autonomic nerve problems. Added to that with the adrenals. So this is a real important issue. The fact that you're kind of swinging like this, you know, clean the lymph system always, because it's the lymphatic system in the pancreas can shut down beta cell production of insulin. Neurological type 1, obvious. So either way, you're going to get into the adrenal glands. You want to use the pancreatic formula anyway. You want to stay raw as much as possible, fruits and especially if you're having a hard time producing insulin. I've proved this over and over again, some of the theories that about fructose, but I can tell you fructose in a type 1, once you get through flipping and glucose, what I call glucose loading, you're going to see your blood sugar stabilized on fruit. Once in a while I have a real brittle, but I've been able to, with insulin pumps and everything else, even the brittle's been able to control it with fruits and vegetables. What you wouldn't do is protein or starch. Right? Those are big no-nos with all blood sugar problems. But they're no-nos for health anyway. You know. So really going that way. But always move on your lymph system, sweetheart, and you'll be fine. On the insulin, I can only tell you, not my field, and so we don't want to make any medical doctors mad because they don't help you much, sorry. But you would not want to give yourself the same dosage of insulin if your blood sugars are coming down, now would you? That could be serious, and I'll highly, highly warn you that if you do, if you don't, you could end up into a diabetic coma. I've happened to one of my clients, and she didn't listen to me. I told her, you must monitor your blood sugar because there's two facts for sure in this program. Your blood sugar and your blood pressure is going to come down to normal. Some quicker than later. I had an RN in Miami who was 40 units in the evening, and I think 40 or 40 some in the morning. And in 1 week, she had to stop him. She said, I cannot believe this. This is freaky. So some people quicker than others. There's others that are just pulling my teeth out when it comes to type 1, and yet there's others that just go right on down the road and do it. So when there's genetics involved and everything else, you just take your time and rebuild. The older you are when you see type 1, you can pretty much figure either lymph or nerve, two causative factors. And so you really just start rebuilding the body and keep your sugar simple. But in most hospitals, they don't give insulin until 200. So, and generally they only give 5 to 10 units when your blood sugar's 200. So keep that in mind. Someone wrote me and they're on metformin, same type of thing, but they're type 2. Well, type 2 is the adrenal glands. Type 1 can be the adrenal glands, remember, when it's a neurological type 1. How do you know the difference? Good question. Can't say that I know, except that you notice your problems post-surgeries with the anesthesia, or maybe like in your case, sweetheart, where you see it flipping, perhaps that. Good question. So you guys are getting good questions here, and I really appreciate that. Helps everybody out. Let's see, this is Six String. Hey, Six String, I felt a pain in my chest that felt like a minor heart attack. I felt weak. I thought it was a pulled muscle in my chest. I spoke to someone who lost weight on your program who said she had the same symptom, and a doc told her it was a type of healing crisis. Well, I'd have to know more about chest and where it is in the chest and that sort of thing. When you're pulling on the lungs in detox, you can have a lot of pain. Stomach can give you pain, and sometimes if you build up gas can mimic heart attacks, and there is silent heart attacks, no question about it. But doubt it in a detox is possible, but doubt it in a detox situation. But again, I mean, when you're talking about the movement of lymph, you're talking the movement of toxic chemicals, the movement of neurotoxins, you're talking about the movement of stagnant acids. So any type of reflex is possible. Any type of little spasm is possible to go through, especially when the body moves something, moves the lymph, and that lymph has been in that area pulling calcium and everything else. The area is highly spastic in the first place, or pre-spastic. Yeah, you could have some spasms like that. But remember, if you feel like you're having a heart attack, you rub this part of your left hand clockwise, and on the bottom of your foot, right over here, here's your pad in your foot, you're going to rub right here in the heart area, and that'll relieve. You can also rub right here in the heart area clockwise, and that'll give you some relief. And if someone's in a heart attack, you grab those spots and work on them, and you'll pull them out of it. Done it 3 times. I've been eating a lot of grapes for about a week or so for the arthritis in my hands. The only problem is, yeah, I'm really hungry. The pain is in my hands is better. Well, it just shows you you're moving lymph there. Well, have your salad at night then and see if that'll do, or just have just a ton of grapes. This can be real strong. And especially in these cold, darker winter nights, that's why I kind of say through the winter, you might have to, might have to do a salad, do some warm herbal teas and things like that to warm you up. If you still feel hungry, maybe do use some steamed vegetables or a baked sweet potato. It's going to slow you down a little bit, but that's why the next morning you get up and you do fruit all day long, and then at night maybe you slow up a little bit. If you can start getting relief doing that, then you'll be good through the winter and everything is good. But you're doing a good job. This is L-I-E-N. Lean. This is, you're doing a good job, though. Proud of you. Good job. I mean, no one said this was easy. You know, for some it is, because for some it's like jumping into a nice pool of warm, beautiful, refreshing water. It is for me because I love this way of life. I love fruits. I love berries. I love melons. I love my salad. So when someone says, "Oh, this is," I say, well, "What's tough about it?" I love all those foods. I mean, because you know, I started out tough. Yeah, you know, farm boy, steaks, meat, you know, all of that stuff, and yeah, but I was really right for it because I don't like to suffer. And I've always suffered with sinus and lymph problems. So I just, whoa, this sounds good. You know, most spiritual people are going to dive into it when they know it's rings of truth and spirituality and growth. Yeah, you're going to make a dive into that pool. But for some, you want to, but it's tough with the self-disciplines and everything. And I totally understand that and am compassionate and on your side. Had I not had my life up and down, I probably would have sit here and banged on your head. Get with it, go, go. You know, it's like I've lost clients before like that, and it's like, no, I believe in balance. I believe in us all helping those that are weaker through this till they get stronger, and then they can help people that are weak get stronger, and that's what we're here for. We're here to have love on this website, and I really want us to get that way. If we have our differences, you know, we mend them and go on. Who cares? We got to be like the children of life who maybe get in a little spat and then, okay, and then go right on. And most of you have been able to do that. So we need to all do that, including Wonder Why, sweetheart. Let it go. Come back and enjoy us. We enjoy you, Kelly. All of us, get good, get going. I just really love what you're doing. I feel like I've done a good job at putting this site up for you. I don't have any regrets doing that. This has just been a real help for me, and a little bit of work, but really, I just love you all. Julia, got your thing here. Nuking, I love the way you talk. Nuking the fungus with Parasite M. You're a cutie. Yeah, you know, that's basically what you got to do. Sometimes you might have to stay on Parasite M for a while, but you know what? You nuke those funguses. Clean your lymph system up there. It's funny. Thanks for the, we've tried, you know. I think when you look at companies, we get a lot of companies and their products are broken and they're wrapped bad, but if you look at the care we've done, we decided years ago that we were going to try to be impeccable with our wrapping. Sometimes we'd like to have better stuff because, you know, flashier labels and stuff like this, you know, but everything's very expensive. We never did have any backers. We started out in the kitchen, hand pumping these herbs. I'm telling you, we started from the very basic. I had the company in our garage for a long time. I mean, we've been in a lot of places, you know, and so getting better. But this is funny. You make me laugh. Good job, Julie. Oh, let's just see. Superhuman. I was wondering if you, Robert, or any other here have been on a raw food, primarily fruits, for a long time, can commit more in regards to feeling cold. Yeah, I will say that